I am Sarah Adler. I'm the founder and CEO of Wave. Wave is really an access to care play. So there's a huge problem. We all heard about the supply and demand imbalance with therapists, not enough in the world to take care of all the people who are really suffering and struggling with mental health needs.
Right.
And Wave really is designed to combat that. And it's based a lot on my research from Stanford, which is in predictive analytics, deciding who belongs where at what point. We've combined that with what's called a stepped care system. So we have everyone coming through our evidence-based app as a digital entry point. We then step them up as care based on when the algorithm tells us and when our humans in the loop tell us that someone might need a higher level of care. We keep it really efficient. Most of our folks are actually treated using health and wellness coaches and only stepped up to top of licensed practice with a licensed therapist or psychiatrist as needed. So the idea here is to really increase access by creating a digital entry point, which is a huge barrier if people can't find the person that they need to take care of them.
Yeah.
And everyone's moving towards a digital world anyway. Also, with a more scalable workforce with our health and wellness coaches, and then again, really only using the most resource-intense folks at the top of their license when needed.
Yeah, got you. And what's that go-to-market? Is it directed to direct-to-consumer, working with the providers? How does that work?
So yes and yes. So we actually started off in the direct-to-consumer market mostly because I wanted to validate the solution that we were creating. And I'm a clinician, and so that was very important to me to be able to demonstrate outcomes, that this is something I'm not just bringing to market because I think I have a cool business idea, but this is something that actually has demonstrable reduction in symptoms. I'm a clinical psychologist. It's incredibly important to me. So we started off in the D2C marketplace, knowing that it really would never be more than maybe 20% of our business, just because cost of acquisition is so ridiculously high, and there are a lot of big players in the space who are kind of eating up ads right now anyway. But we did want to make sure that it was our best sort of way to get user-centered feedback, iterate on our product, as well as get a critical mass to demonstrate outcomes so that we can then go to health plans and employers and say, hey, our outcomes are so much better than what you are seeing. We're actually measuring, which is something that's sort of unique to us in the space, and we can therefore demonstrate an ROI to those who are paying for the care.
Yeah, got you. I think you've touched on already the size of the mental health issue across the US, across the world, but also because of the size of that issue, it's a crowded market, as to say, in terms of being in the mental health and the wellness space. Why does it need to exist, or how does it? You already mentioned there's a bit of differentiation there and something a bit unique and tying in with the payers there. But why does it need to exist?
What really makes us different? Yeah. So it's interesting. Many of our competitors started off in the therapy space, and the reality is it's very hard to build a venture-backed scalable business in the therapy space. People are trying to do it. But it's expensive. The margins are a lot lower, and eventually we run out of therapists as a workforce. There are only 550,000 licensed therapists in the United States. I don't know the number globally. But ultimately, we need to start looking at technology, data, and lower resourced human capital, human providers in order to really scale and in order to really meet the access needs. Because hundreds and hundreds of millions of people are struggling with their mental health. There will never be enough therapists to actually treat that. So we have to look at different ways of delivering care.
Do you find that there's different demographics that respond better to this type of care?
Yes, actually. So we started off in the younger folks. This is a sort of what I very lovingly call the misery generation. This is a generation of folks. Gen Z has started talking about mental health in a really, really fundamentally different way than us older folks. I actually have no idea how old you are, but I'm going to guess you're older than Gen Z. Yeah. And part of that is we've really equipped them. We've given them the language. Social media has done a lot of that work for us. Everyone is constantly talking about their mental health. And so we really decided our beachhead was going to go for 18 through 26-year-olds.
Yeah.
We didn't want to go into the lower Gen Z space for business reasons, but also for clinical reasons. We wanted to really make sure our model worked before we started giving it to children.
Yeah.
Crazy idea.
All right.
And what we ultimately found, although we designed for 18 through 26-year-olds, what we ultimately found was that almost everyone really loved what we built. And so everyone loved our app, everyone loved our art styles, our user-centered design turned out really well for almost every generation, except mine. So Gen X is very much the therapy generation. They want that one-to-one therapist. They're not interested in the digital entry points in the same way. They're not as app fluent, but boomers love it. love it, love it, love it. Millennials were really psyched about it, as was Gen Z. So we sort of expanded once we found out, oh, we built something people really like.
Yeah, amazing. It's good to have something that bridges across those generations. And I guess that user experience, I think, is that point that's tying it together. I think that's really important and a common issue across any generation. So, and it's a global issue. Is there plans to look at servicing outside of the US?
Absolutely. And I think a lot of the employers that we work with, we have a lot of operational efficiency because we are using, for the bulk of our care, non-licensed providers. We use board-certified health and wellness coaches who are trained in a proprietary evidence-based intervention that is demonstrated scientifically to work. But because we're using really lay healthcare providers, it allows us to scale into other countries kind of quite easily. We haven't figured out, we're not at the point yet where we figured out how to deal with language barriers and different cultural competencies and things like that, but we are absolutely working with employers who have teams in other countries.
Yeah, no, that makes sense. And lastly, what's on the horizon? Where are your priorities at, and what could the folks say?
So we are super excited to be partnering with health plans right now. We are currently in network with Aetna, covering their 3.5 million lives in California, and we are just expanding rapidly our footprint. There's a couple of exciting contracts in the works where we will get more health plan coverage. And then really we're also talking to a lot of employers, and so scaling there. We're also super excited. Most of our model, our technological backbone, is really focused on predictive analytics, focused on different ways to use AI in a very ethical and responsible way. So that is absolutely on the product side of our roadmap.
Yeah.